Hi, Chris Hayes here from Hayes Physical Therapy in Paoli, Pennsylvania. I want to talk to you today and give you 3 easy exercises if you're experiencing sciatica, which is an inflammation of the sciatic nerve from the back down the leg. Can occur in one leg or it can occur in 2 legs. Sciatica can actually be caused by several different things. Could be a herniated disc, could be spinal stenosis, or it could be a sacroiliac or pelvis problem. So it is important that you're treated with the right type of exercises depending on what that root cause is. Let's assume today that Tyler is someone that's over 50 years old and he's somebody suffering from spinal stenosis. He's been told that. And so basically that is an arthritic problem in the facet joints in the low back. Typically, spinal stenosis affects people 50 years of age and older. Standing and walking greater than 15 minutes can become problematic. Sometimes you'll see people pitching forward with their shopping carts in the Acme or Costco, and they're doing that because they're in pain and it opens up their spine. And then typically sitting relieves this. But the sciatic nerve is very, very inflamed. So I'm going to give you, if your diagnosis is spinal stenosis, I'm going to give you a couple exercises that might assist you. So the very first one is, Tyler, I'm going to have you lie on your back for me and bend your knees. And the very first exercise, I want you to bring one knee to the chest and then the second knee and just hold that stretch. So relax your head, and he's going to hold that stretch for 30 seconds to a minute. Right now what's happening here is that his spine, that normally has some bone spurs or some compression to that area, is actually gapping open, giving some relief and some space to the sciatic nerve. The sciatic nerve is like stepping on a garden hose, and then that pain reflects down into the leg. So while he's in this position right now, he's taking that pressure off that garden hose, which will relieve some of the symptoms. As he stays here for 30 seconds to a minute, his back muscles should totally be relaxed. He's not holding his breath, he's just relaxing. And coming out of that stretch, take one leg down first, back down to bent position, and then the other. Okay? And let's try that one more time. So typically, go ahead, one knee up, then 2, and hold 30 seconds to a minute. Typically, we might say doing this 3 to 5 times would be helpful. The only caveat to that is if you have osteoporosis, this would not be a good exercise for you. So, mostly women can develop osteoporosis as they get older. This is too aggressive for osteoporosis. And we do have an osteoporosis specialist in our practice who can modify these exercises. But right now, assuming Tyler's good, one leg down and then the other. Okay, that's exercise number 1, double knee to chest. Roll to your side, Tyler, and come up to sitting, legs over the edge. The second exercise is Tyler's going to sit up nice and straight, and he's going to bring his chin down to his chest, and then he's going to slowly extend that right leg all the way up and toes to the nose, 5 seconds, and then he's going to bring it down. He's going to keep his head in this position, and then he's going to repeat that on the other side. Toes towards the nose, 1, 2, 3, 4, 5, and down. And he's going to repeat this maybe 10 to 15 times and continue. He will feel a little bit of a stretch in the back of the sciatic nerve. That's normal. If it's too uncomfortable, you just hold it for 1 second. And so this is called a slump position where the head is down and then back. The alternative to that, if that bothers you in your head and neck, is Tyler, come on back up to nice and tall. Put your hands behind you here, and then I want you into the tall position. Lean back a little bit, chin up, and now repeat the same exercise. And toes towards the nose, 1, 2, 3, 4, 5. That will still stretch the spinal cord and also the sciatic nerve. Those 3 exercises will be great. And also use ice, not heat. Come on out of that. And that's our sciatica basic 3.